Okay. Okay, just before we get started, a little disclaimer here that the presentation tonight contains general information only. Every effort has been made to ensure that the information is accurate and reliable, and the content of the presentation is certainly not a substitute for the individual treatment advice that you may receive from your doctor or healthcare professional, and always consult with them to obtain individual medical and treatment advice. Okay, so this evening, we're going to be talking about and exploring what complementary and alternative medicines are. I'm going to be referring to this as CAMs. Just going forward, we're going to be looking at the effectiveness of CAMs, some safety and some side effects as well, and also mentioning quality use of CAMs, so you can go forward and use it as safely as possible. Okay, so first of all, what is complementary medicine? First of all, let's have a look at the words in what make up CAMs. The first one is complementary. Complementary is generally taken to mean alongside, in this context, Western medicine, whereas the alternative part of CAMs is taken to mean instead of. And it's in stark contrast to Western medicine, which is a system in which medical doctors and other healthcare professionals, such as nurses, pharmacists, and other therapists, treat symptoms and disease using drugs, radiation, or surgery. That's what Westernized medicine is. But CAMS is a group of diverse medical and healthcare systems and practices and products that aren't generally considered part of this paradigm, which is the Westernized medicine or medical model. So it's generally considered part of not generally considered part of the conventional medicine, and complementary medicines may also be known as traditional, or you might also know them as alternative medicines. So I thought this might be an interesting point to bring up. Where does it fit in? So CAM, it's often outside of mainstream, and in the context of arthritis, particularly osteoarthritis, sits outside the mainstream first and second line treatments for osteoarthritis, but it generally sits alongside, like we mentioned earlier, other and main Westernized medical treatments and management approaches. So in the context of arthritis, generally speaking, we're going for exercise and non-pharmacological treatments as the most conservative ways in which we treat. Now, at that level there, we may actually funnel some of CAM's therapies, and we're going to be talking about some of those. For example, it could be supplements like we could try omega-3 type supplements, for example. Different types of exercises like Tai Chi, which is part of traditional Chinese medicine, which comes under the CAMS banner. But as these fail us, we might then seek other types of pharmacological medications. And then, of course, last but not least would be further intervention being surgery. But yes, like I mentioned, CAM sits alongside and in most cases complements the Western medicine model. But more and more people are turning towards CAMs to help supplement Westernized medicines. So that's what CAMs is. Let's have a look at how they're categorized. So there's often 5 categories used to describe CAMS medication, or should I say CAMS medicines and alternative therapies. First, we have mind and body therapies. Now, these are not limited to the examples that I have. There are, in fact, many, many more. So mind and body, we're looking at biofeedback, meditation, yoga, Tai Chi. Biologically based practices, we're looking at dietary supplements, vitamins, minerals, herbs, spices, plants, roots. Manipulative and body-based practices, massage therapy, chiropractic and reflexology. We have energy healing, such as Reiki, craniosacral therapy, and therapeutic touch. Last but not least, we have the fifth category being whole medicine systems. And this would be the alternative. So this is where people may opt to use this type of medicine instead of Western medicine. These include things like traditional Chinese medicine, Indian traditional Indian medicine, naturopathic, and homeopathic medicines. Now, I know there's a lot there, and I obviously can't go into every single one of them, but I'm just giving you an idea of the breadth and the variety of complementary and alternative medicines. Okay, so in terms of CAMS practitioners, they come under primary care. So much like GPs, CAM practitioners come under primary care. So these can be practitioners that we seek out as people see at the first line, basically, first point of call or some form of contact of care in the Australian health system. And these are people or professionals like naturopaths, homeopaths, nutritionists, massage therapists, chiropractors, osteopaths, acupuncturists. This would be burst the allied health professionals, and these are involved in the delivery of health and related services pertaining to the identification, evaluation, and prevention of diseases and disorders. So these might be more your diagnostic type healthcare practitioners that might be more and highly regulated, like physios, specialist doctors, clinical psychs, dietitians, speech and language therapists. To get a bit of an idea of what people think about CAMS, well, this is based on a consumer survey. This was a little while ago from 2008. But this is the majority of people's understanding or perception about CAMS. The first perception is that because it's natural, and we're mainly talking about, I think in this context, mainly talking about the supplements, for example, so the herbs, the roots, the spices, and things like this, because they are natural, that they're safer and they're free of side effects. But natural doesn't always mean safer, and natural doesn't always mean that there isn't any side effects. And often people think multiple ingredients working together yield better results, but sometimes multiple ingredients working together or a certain dosage of a certain type of supplement or mineral, vitamin, could actually not yield better results, and in fact could also have drug interactions with other mainstream medications that you might be taking. So, and that's why I say here, well, some of the time, more and more studies are going into CAMS, but there is little or less scientific evidence available as compared to westernized mainstream treatments. Many of those are a lesser or of a poorer quality study. They may have inaccurate or exaggerated results. And I'm talking here of clinics that may, or pharmaceuticals or places that actually make and invest a lot of money in creating supplements, who then do in-house clinical trials, and they're almost always biased. Benefits obviously vary depending on the type of arthritis, and there's always need to make sure that the benefits have been clearly demonstrated through scientific rigor. So in terms of regulation, in Australia, before CAMS products are sold, and again, I'm talking not necessarily the therapies like massage, for example, I'm talking the things like the supplements, the minerals, the vitamins, and things like this. Before they're sold, they are assessed by the TGA, so the Therapeutic Goods Administration. They're our regulatory organization in Australia, and they'll evaluate products for their safety, quality, and effectiveness. The TGA often aligns and collaborates itself with the FDA, Canada Health. So that's the Food and Drug Administration. CH is Canada Health, and NICE is the National Institute of Health and Care Excellence of the UK. So they're all fairly well aligned. They're often products are often set to a assessed at a 2-tier system of regulation. So they'll either be listed or registered. Okay, and this will be depending on their ingredients and the claims made through studies. So I'll just show you what that looks like. So things that might be listed, okay, it should be labeled on the product or the larger packet. These things contain low-risk ingredients that are that relate to non-serious health conditions. Again, it's quite generalized, of course. They will be assessed for quality and safety, but not efficacy. And examples include most complementary medicines. Whereas if it is registered, and this is from the TGA, these are things that contain higher risk ingredients, might be more dangerous, cause more side effects, or are used for more serious health conditions. And these are assessed for quality, safety, and efficacy. So the efficacy is the degree to which, for example, a vaccine, a cancer medication, for example, prevent a particular condition under ideal or controlled circumstances. So what that says there is that CAM's medications, vitamins, minerals, herbs, roots, powders, and things like that aren't necessarily tested at the TGA level for efficacy, but they are for quality and safety. Okay, so going forward, what I'm going to do is I'm going to run through some common CAMs that I get asked about, or that we have got asked about over the years, and we've compiled it into this presentation here. And what we're going to use is a document created by Arthritis Research UK. Now, I will admit that this was produced in 2012. It's old, but what I've done is ensured that I've assessed what this document claims, or the outcome of this document, with more up-to-date research on the different products. If it has changed, I will have made the change. If it has been kept the same, then it is kept the same, and it really hasn't changed. Okay, so while this document is old and is based on it, I've ensured that it stayed as up-to-date as possible. So how we'll do it, apologies. So what this document did was it produced an evidence-based report on the use of complementary and alternative medicines and therapies for arthritis and other musculoskeletal conditions. And it also looked at the research and evaluated the effectiveness and the safety of them. And how we're going to illustrate that is we'll do a sort of bit of a Likert scale here, if you will, or a 1 to 5. If a product is given a number 1, it'll indicate that there isn't a whole lot of evidence to support its use or its efficacy. Number 5, if it gets given a 5, it will indicate that there are several studies show that the complementary therapy or the medicine is effective, and that research may be of better quality. Also, we'll use a traffic light system to understand whether an easy visual cue to know whether it is safe. Basically, red indicates serious side effects, amber less so, and green minor side effects. I'm going to say now that they've all got a green tick or a green traffic light. They've all got minor side effects, but some that you do need to be aware of. Okay. Now, I can't explain and I can't go into a deep dive into all of these just because time permitting. But again, if you want to know more about a certain Cam, that I've spoken about tonight, please email me or ask the question in the chat box and I'll do my best to get to it. But so I'll often briefly go over these, and the reason is because there are many of them, and I want to try and get them in the time remaining. So the first one is acupuncture, and acupuncture comes from traditional Chinese medicine, which is an alternative medicine. Acupuncture is a therapy that can be used complementary to mainstream Western medical model. So this technique is basically where we're inserting needles into what we call our chi points or energy points in the body, and the acupuncture itself aims to restore energy or chi or ki in the body, essentially. So in terms of the effectiveness score, look, more and more research into acupuncture has been done over the years. However, the results are still fairly mixed, and often it doesn't come up better than sham needling or placebo. So that's why I suppose the effectiveness scores are still low, only because the research that may be, the quality of it and is potentially poor, and also more evidence or more studies need to occur to sort of, I guess, collate a better understanding of the effectiveness of acupuncture. So this is true for both osteoarthritis and rheumatoid arthritis. But like any other manual therapy has a way to distract from pain or the pain experience. So I think any manual therapy like massage or acupuncture or sports massage or anything like that can be effective temporarily in terms of reducing pain. Okay, in terms of if it's safe, look, it's fairly safe. When I say mild bleeding or bruising, this pin is very fine. It's a filiform needle. So the bleeding that you'll get is like the bleeding that you get from, probably less, from when you would get a vaccine, for example, because those needles are quite, they're bigger than these fine filiform needles. So in rare cases, nausea, dizziness, some people don't like needles. Don't get acupuncture or dry needling if you don't like needles. Precautions, of course, anybody with a bleeding disorder, anyone might be taking blood thinners such as warfarin, probably be aware of that and avoid it if necessary. The next one here is massage, and what I'd like to do is cover the different types. So relaxation, remedial, and myotherapy, which adds an edge of assessment into and more targeted massage or treatment to a joint or area of the body. And these are all classified as complementary therapies. The myths, these are all myths for massage. It's a myth that it removes toxins. No, massage does not remove toxins. The only thing that removes toxins in your body is your liver. So if you've got a functioning liver, you're okay. Massage doesn't remove toxins. It does not improve circulation, not systemically anyway. At the level or area of where you are massaging, you might get some redness and there is localized circulation, but on a superficial level. Massage doesn't realign bones. It doesn't realign joints. It doesn't realign posture. It doesn't cure cancer, reduce delayed onset of muscle soreness. It doesn't reduce inflammation like we thought that it did. It doesn't reduce cortisol levels. So there are many, many myths to massage. So you might be asking me, Kat, well then why? Is it good and what's it good for? Well, it is good actually. And so a little bit of truth here in that massage can improve baseline anxiety and depression, likely because it's essentially a relaxing experience. And so that's good because we know that people suffering with arthritis will often co-present with anxiety or depression or a mood disorder. It can also temporarily reduce pain and improve range of motion. And this is likely due to the mechanical and neurophysiological modulation. So just changes again, input of sensation distracts from the perception or experience of pain, essentially. But sometimes you need a circuit breaker from your pain and your stiffness, and massage is a great circuit breaker. Is it safe? Yeah, it's fairly safe. There may be a little bit of soreness afterwards. In mild cases, rhabdomyolysis, which is just where the muscle breaks down into proteins. It's a crush symptom, but in very, very rare cases will that happen. Precautions, if you're taking blood thinners like warfarin, if you have deep vein thromboses, any sort of fever, contagious disease, probably you want to steer clear of anything if that's the case. Tai Chi is another type of therapy or movement therapy. Again, this is part of traditional Chinese medicine. So Tai Chi involves very slow, gentle movements, including deep breathing and relaxation exercises. And it involves those slow and gentle movements constantly being moved back and forth by shifting your legs. And there's also arm movements involved. And you're often doing it in a group of people. There's a bit of a social aspect to it as well. Is it effective? Yeah, look, there's actually some really good research coming out now. This I haven't changed so much from 2013. If I were to tweak it, I would bump up the effectiveness scores here. I would give both RA and rheumatoid arthritis a 4 or a 5, because there's some really good research out there about how Tai Chi can really help people manage their pain and their stiffness, but not just their pain and their stiffness, but also their mood, anxiety, and a sense of connectedness as well, because it kind of focuses holistically. So physically, yes, it helps us physically, can provide movement. A bit of a segue if you're quite sedentary and you want to get moving again. This is a gentle optional or alternative, but it also helps with mindfulness and a bit of meditation. Is it safe? Yes, it's safe. Look, like anything, any type of movement or exercise, there may be a little bit of muscle soreness during or afterwards. And because we're standing, we might be standing for longer than what we're used to, some foot or knee discomfort. Here we've got copper bracelets and magnets. This was once thought to really help improve our symptoms of arthritis. It was believed that it would seep, like the copper, for example, would, particles of that or elements of that would seep through the skin to ease painful areas. There's really not a lot of or any evidence out there for this. So I'll just sweep straight past that and then going to more the medicines or supplements type CAMs. So fish oil is a common question. Is it good? Do I take it? Do I not take it? So I think it's good to address this one here. So fish oils is rich in omega-3 fatty acids, which have anti-inflammatory properties. And because of this, there's actually been a lot of research into fish oil and its beneficial properties and its effects systemically on systemic inflammation, but also for those with arthritis. So we're looking mainly at fish body oil, or what you might commonly know as just fish oil. This is from tissues of fatty fish, whereas the fish liver oil is the pressed cooking oil. For example, could be cod liver oil, for example. And what we don't want to do is not confuse fish oils with fish liver oils. And the reason being is that fish liver oils also contain vitamin A or higher vitamin A quantities, and taking large amounts of these can actually cause some serious side effects. So just be aware of that, and that's obviously coming up. So generally fish oil, there's some pretty good evidence behind that for rheumatoid arthritis, which can be generalized into osteoarthritis. So it can help improve, or it has been shown to improve the symptoms associated with RA, so joint pain and stiffness, for example. And there are just some parameters about perhaps how much you should be taking. The recommended dose is 2.7 grams. You might see that as 9 to 14 standard 1,000 milligram fish oil capsules, or 5 to 7 capsules per day. Now, in saying that, I just like to note that it's nice to have supplements there, but only if we need them. And so it's good to get these type of things, like, for example, good omega-3 fatty acids from our diet. And in fact, Bree might mention something about that a little bit later this evening. Okay, so we have for osteoarthritis, like I mentioned, similar here. There is some evidence that fish oils may help. So the fatty acids, omega-3s, may help manage osteoarthritis symptoms. Here, as compared to rheumatoid arthritis, and this might be comparable to the severity or the difference between the two, that fish oil supplements at a lower dose can be useful. So if I can just make sure we're on, sorry, Angela. Thank you, Angela. So you may need to, so this is quite common among many of these supplements, and you might find this with normal pharmacological medications that you take for pain, but sometimes you might need to take a certain supplement for a longer period of time, like 2 or 3 months, before you notice improvements. So what I like to say here is that, is it worth taking? Well, first of all, I need to have a look at the evidence. Is there efficacy behind it? Is the research good research? So have a look at meta-analysis or reviews instead of just single studies. And the second is, well, how long do I need to take it before I see some sort of improvement? Is it worth my time and my money? Okay, so here we might need to take it for a couple of months before we see some form of improvement. Look, is it safe? It's fairly safe. We have some side effects, generally GI upsets, essentially. If we overdose on our vitamins and minerals and things like this, it can cause some stomach upsets or nausea, for example. Precautions, as I mentioned, is that high dose of vitamin A. So I think it's always a good idea to consult a dietitian or nutritionist on this aspect. And here's an example of where CAMs, vitamins, minerals, can have drug interactions with warfarin, can affect the effectiveness or the efficacy of warfarin, okay? So again, good to just double check with your doctor and or dietitian nutritionist if you are wanting or are taking these types of supplements and you are on other medication. Okay, glucosamine. Another glucosamine and chondroitin, which is coming up next, are again two very common supplements that I get asked about. Glucosamine is a nutritional supplement derived from shellfish. Okay, and it's often found naturally, or it is found naturally in the body, and it's the building block, or one of the building blocks of joints, tendons, ligaments, cartilage, synovial fluid. So in that respect, logically, people think it would make sense that if I take this as a supplement, then it's going to help perhaps repair the integrity of my joint structures. That's not always the case, though. So as you can see here, it's available in different capsules, liquids, and creams. Like most vitamins, minerals type things are available in different modes. But I will just jump to the effectiveness here in that often it's sold in sulfate or hydrochloride. Look, essentially at the end of the day, it doesn't particularly matter because the effectiveness scores here are pretty low. So the trials can be not necessarily very convincing. Perhaps poor studies behind them. But perhaps this would be one where it maybe not worth your time or your money. Oh, that's interesting. I've got someone drawing on the slide. Okay. It's really odd. Recommended doses, though, if you did want to give it a go, about 500 milligrams daily. Again, you might need to take it for a long period of time before it is effective. You find any sort of improvement in your symptoms. Is it safe? Again, fairly safe. Precautions would be allergies to shellfish. Again, interactions with warfarin and other means of treatment like chemotherapy and cholesterol lowering medicines. I am moving a little bit quicker. I do understand this. It's recorded. You can also come back and read the slides later. Okay. Chondroitin, as I mentioned, these two often go hand in hand, and you'll often find that they're sold in a supplement together. I'm just wondering if, okay, that drawing is now gone. So again, chondroitin, much like glucosamine, is naturally found in the body, a vital part of joint cartilage. So again, the theory thinking here, logical thinking here is that, well, if I take this supplement, then it'll go to my cartilage, or it'll go to the area that it needs to go, and it'll improve that particular area, improve my osteoarthritis. But that's just not what happens, or it doesn't happen like that. There has been a very small study, once again, very old, 2008, the combination of chondroitin and glucosamine reduced pain in those with moderate to severe pain. So again, there is a little bit of evidence. So the effectiveness score for the OA there is 2, but with rheumatoid arthritis, there is not a whole lot of evidence. There might be a little bit more now, but really the efficacy here, it doesn't stand up. So perhaps still unclear and mixed. But nonetheless, if it's safe, look, it's fairly safe. Again, recommended dosages, you can see there, 8 to 1200 milligrams. If you were to take it and you found that it worked for you, you might see it starting to work from 8 weeks to 3 months. There may be some mild side effects, again, similar to the others, being GI upsets, potentially headaches, potentially with asthma as well, may worsen breathing problems, and again, a drug interaction with warfarin. Okay. We're doing well. We have turmeric here. So it's often used in cooking. So a yellow spice. It's warm. People describe it as this warm, bitter taste, and frequently used to flavor or color curry powders, mustards, all sorts of different things in the kitchen. And I guess the reason for use is that it contains some anti-inflammatory properties. And it might, yeah, like I said, might reduce swelling, might have some form of inflammatory property to it. But again, research is out there, it's coming along, though it may be mixed in terms of its efficacy. There can be concern for variation in concentration and a range of products marketed for arthritis. So we could have a product out there, say it did work, but the active ingredient, the quantity isn't high enough to have a therapeutic effect. And so you are using and wasting, you're wasting money on buying a product that isn't going to be therapeutically beneficial for you. So a lot of studies that have been shown sometimes have been biased, have been of low quality, and there are inconsistent results in its efficacy. Look, is it safe? Look, enjoying it in food or drink should be fine, but if we're adding a lot to try, like in terms of quantity, to try and get some sort of benefit. Again, GI upsets, for example. Large doses can actually increase risk of kidney stone formation, so be aware of this. We don't know really if there's a whole lot of drug interactions and if they've been studied, and there's no definitive dose recommended. Rosehip oil is another one. I'll just briefly skim over this one. Rich in vitamin C, essentially. Believed to help with joint inflammation, essentially. In terms of effectiveness score, what's out there? Look, in the past, there have been some trials that have shown some promise that it can reduce some pain and reduce a little bit of stiffness. Again, but dosages hasn't been well studied or quantified. Some studies have gone with 5 grams daily. This has been used in clinical trials, but again, a GP, I often say a GP, but really a GP is not going to know, depending on the background, of course, but in general, a GP probably isn't going to know a whole lot about complementary alternative medicines. This is something where you would certainly ask them, but then seek further advice from someone or a practitioner of that field. So you're looking at dietitian, you're looking at a nutritionist or a naturopath. Is it safe? Again, I told you, they're all green. They're all just got very mild side effects or symptoms. As you can see here, no drug interactions have been studied. Okay, capsaicin though, I feel like this is one of my favorites. This compound is taken from chili peppers. It works by mainly reducing something called substance P. It's a chemical, if you will, a molecule, if you will, that surrounds tissue damage in a body. Oh, that's an example. It's always present when there's inflammation in the body. So substance P is a pain transmitter in your nerves, and so it works as an analgesic, essentially. So it reduces the amount of substance P, or it's sort of breaking the barrier as a messenger to the brain. Now, yes, so results from randomized controlled trials, which is RCTs, for assessing its role in treating OA suggest that it can be effective at reducing pain and tenderness in affected joints. And there's no major safety concerns. So though you do need to be careful about how much you are applying, of course. Capsaicin isn't new. It is used in neuropathic pain and people with diabetes, for example, and shingles. So there is some pretty good research behind this for osteoarthritis. And fibromyalgia, this is again from the report itself. So fibromyalgia was in there, and though we know that fibromyalgia can coincide with forms of arthritis. So just an interesting fact for you there. So yeah, give it a crack if you have osteoarthritis. It, to an extent, can be generalized to rheumatoid arthritis, though again, if you are going for a capsaicin cream or patch or something of this nature, again, you do need a script for a certain amount of capsaicin. So talking to your GP is important. But dosage trials have either been used for 0.25% to 0.75% of capsaicin gel to the skin 4 times a day, and this has demonstrated to be somewhat effective at reducing pain. It is available by prescription, but can also be found in over-the-counter products as well. Obviously, the percentage or the quantity of the active ingredient will vary. For quantities or higher quantities, you will need a script, but do ask your pharmacist what products they have to help reduce pain in joints. Ask for about capsaicin products and what they may be able to prescribe to you. Is it safe? Look, it's fairly safe. Okay, there can be a slight burning sensation when the gel is applied. Okay, and there can be some brief skin redness in the area as well, and you want to keep it away from your mouths, eyes, and open wounds, because that would that would sting. Okay, I'm not sure whether you've all been waiting for this one, but cannabidiol. So the two most abundant cannabinoids from the cannabis plant itself are CBD, which is what we're talking about here, cannabidiol, and THC. And obviously THC is that gives you the psychotropic high, if you will. And you can buy CBD products without this element in it, okay, which is good. And it's already used, not necessarily commonly, but CBD is already used again in neuropathic pain, cancer, and people with epilepsy, particularly if these conditions are chronic, which they often can be. So the evidence here for those with arthritis related symptoms, it could help, or it can help, and the evidence is in its infancy, but it is coming along. So there haven't been any rigorous clinical studies yet. They're happening right now though, for people with arthritis to confirm this. And if you're wanting to, you could probably scope universities and other research facilities, because I have seen them ask for participants to be in randomized controlled trials that involve CBD products. So safety, no major concerns here at the moment. Use, never use CBD to replace disease modifying drugs. And I think that's a really great point and a blanket statement to make. Never, particularly if you're taking a disease modifying drug, strongly suggest do not stop that abruptly, and seek medical advice from your GP, of course. Dosages, well, because research is still in its infancy, there aren't any established guidelines yet, and the experts recommend starting with a low dose if you do get your hands on some. And if the relief is inadequate, and you titrate in very small increments weekly, essentially. You might be asking me, well, Kat, where can I buy this from? Can I get it in Australia? What is the go? Well, I've answered you. Is CBD available over the counter at a pharmacies or chemists in Australia? The answer is yes and no. And the reason I say yes and no is because CBD in Australia is classified as a Scheduled 4 prescription drug. Okay. So it is available as a Schedule 4, but you need a prescription to get it, and you need to meet certain criteria to get it. Okay. So yes. But then what they've done is like, okay, all right, research is coming out, the movement, there's been a huge cultural movement all over westernized world, the change in perception of CBD. And so what they've done now is gone, actually does have some really good benefits, or at least the potential is there. So they've down scheduled it to a level 4, a schedule 3, apologies. So what's the problem? Why do I say yes, it's available, and I say no at the same time? Well, the problem is that the products that are on the market, they don't meet the new schedule, which is 3 requirements. So what's happening right now is that many places are frantically running around trying to meet this schedule 3 requirement for a product to be then sold without prescription over the counter. So it's coming. So the down scheduled CBD products must not contain more than 1% THC. So that's the one that might trip you out a bit. They must be 98% pure CBD, now that particular component. have a max dose of 150 milligrams per day, and be listed on the Australian Register for Therapeutic Goods. So it's coming along, and soon you may find yourself being able to get your hands on some CBD oil, cream, supplement, like pill form, for example, and be able to potentially get those wonderful pain reducing effects. You might also want to know how you access these. There are 3 medical cannabis access pathways. A prescription for medical cannabis can be obtained in 3 ways. So any doctor, specialist, or nurse practitioner can request permission to prescribe it. So many special access scheme prescription applications are being approved within 48 hours, which is pretty quick turnover. An authorized prescriber can prescribe this, and also you could take part in clinical trials. Now, I often don't, I am careful with the references and the research that I use to ensure that it is credible. But this website here that I've got down here, the honolulu.com.au, Articles Access Medical Cannabis Australia, that provides some really, really good information, very objective information. Even though they are trialing this, they don't seem that yet. They seem very transparent and very objective in their language and what they're saying and doing with cannabis and CBD. Okay, last but not least, you've done so well. We're pretty much there at the end. I know it's a long one. I did say that it was. People often ask about creams. Well, the RACGP, the Royal Australian the Royal Australian General Practitioners, I'm sorry, I've just had a complete mind blank there. They don't often back a lot of these other type supplements, creams, and things like that. But Physio Cream and Voltaren, there has been some good evidence out there that they help. And the reason that they help, well, one, Voltaren does have non-steroidal anti-inflammatory properties. It actually has that particular drug within it. The Physio Cream, and they both add a sense of heat. Okay, particularly the Physio Cream. It's not an NSAID. It doesn't have that drug in it per se, but it does have the natural herbs and other extracts from roots and plants. And in this sense, it is safe. It's got a nicer smell than Voltaren, most people say anyway. And it helps, again, disrupt pain messages to the brain through heat, adding heat to a certain area. And they're fairly safe to use, as mentioned. Okay, so potential problems with CAMs. And so I might, apologies, sorry. So again, I might just be reiterating things that I've already mentioned. So just very quickly, potential CAMs, there may be a lack of regulation. So think back to the TGA that I was mentioning about. Many CAMs are just generally registered as listed. They don't look at efficacy. For some of them, as you may have heard tonight, there is not a whole lot of dose standardization. CAMs can be diluted. Sometimes we don't know what is in them because we can't read the labels of them. Effective mainstream therapy may be delayed, in which case may make your condition worse. Potential side effects and drug interactions, we need to be mindful of these. There may be a potential waste of time, effort, and money. And I'm not saying this to diss CAMs, not at all, but we just need to be aware. That's all. We need to make informed decisions, essentially. So the next slide, I'm going to let Bree wrap us up. And I'm just going to, Bree, did you want to unmute yourself there?
Yeah, sure.
Fantastic. Bree's going to wrap us up with the sort of last content slide of the night. So I think she might go ahead and talk to this slide.
Thanks so much, Kat. I just want to quickly say it's so great to see so many of people tuning in tonight. So this slide, we're discussing the quality use of CAMs. So when you're thinking of starting a new supplement, it's really important to understand whether the benefits have been clearly proven so that you're not misled or given false hope. And as Kat has mentioned, it's worth doing some research on it and reading good quality research studies. And it's really important to openly discuss this with your GP or specialist, or even your pharmacist or any member of your healthcare team about starting any new supplementations or CAMs, as they may be able to provide you with some information on the existing evidence of their use and to ensure it is safe for you. For supplements, your healthcare team can help decide what the best dosage is for you as well, so you're not putting yourself at risk of toxicity or adverse health reactions. And then maybe some CAMs that have not been thoroughly tested. It's not always known if they're safe or unsafe. If you find that you don't really want to bring it up with your GP or members of your healthcare team because you feel like they may disapprove of CAMs, it's really quite important to keep them informed, because they can't give you the best professional advice if they're not aware of all the treatments that you're using. They can really help you weigh up the benefits and risks. So with the nutrition and seeing about deficiencies and stuff, I'll only briefly touch on this, but if you find that you're wanting to start a supplementation because you're deficient in a particular nutrient, vitamin or mineral, it could be really worth speaking to a dietitian before starting, because they might be able to alter your diet or incorporate foods into your diet to help with your deficiencies, so then you don't need to spend all this money in buying supplementation as well. So it's just a nice little thing to remember, that you could speak to a nutrition professional. So I'll just finish up on this one, because it's almost been an hour, but it's really important to note that supplements, even that they're natural, doesn't mean that they could be good for you. They may interact with some of your medications and make them less active or impact on its absorption. And sometimes they could cause fatal drug interactions as well with certain medications that you might be taking. So that's why we always emphasize that it's really important to speak with your GP or specialist before starting any supplementation. Was there anything else you'd like to add to that, Kat?
No, I think you wrapped that up really well. And I think you summarized, again, points made throughout the presentation, and they're really important points as well. I think just trying to be open as you can with your healthcare team. I think you brought up a good point there about not wanting to bring it up with a GP because you think they may not condone you using it. But even still having and needing to tell them because of, like you mentioned, Bree, some pretty bad interactions or side effects that can occur with medications that you may already be taking. So thank you, Bree. I think you you summed that up really, really nicely for this evening. I think she might be on mute. That's okay. Thanks, Bree.
Sorry.
That's fine.
No, thank you so much.
That's fine.
Thanks for having me too.
Yeah, no, Bree, thanks for popping in. Thanks for wrapping that up with us tonight. I do know that we've literally just gone past the hour. And I know that I can see that there are a few comments there in the chat box, so we may not be able to get to those. If you wanted to stay on for another 5 minutes, you are welcome, and I might just see if I can quickly pick out a few questions. If you need to go, I fully understand, and away you go. Please look out for an email with a Survey Monkey, just a couple of questions giving us some feedback, because if I don't know what you like, then I don't know what to do next. I don't know how to change things. So you're welcome to give us some feedback on the presentation tonight and going forward. Like I said, if you want to stay on, you can. I'll be another 5 minutes. I'll just have a quick look to see if there is any questions that I might be able to answer. Okay. If not, have a great night. Gives me one moment and I'll just scroll back through. I'll do a bit of a lucky dip here. If there are any questions. It's not really a question, but just a general statement here. Someone has mentioned that they can confirm that massage has been very effective in treating lymphedema. Yeah, absolutely. There's been some fantastic evidence behind massage, a particular type of massage, lymphatic drainage, that can really help move lymph fluid around back into the ducts and back into the circulatory system. Absolutely. And you might find that you have trouble with lymphedema if you are comorbid with other conditions, or perhaps you can't move a lot because of your current condition, your arthritis, for example, reducing your ability to move. So that certainly is the case, and it can definitely help. So thank you for that. If you're still on here, I just read a comment here saying that apologies for whoever was drawing on the slide. I could not get rid of that, and I do apologize. I don't. It's okay. I'm not mad, but it looks like a little, a toddler might have been drawing on there, but that's okay. Oh, good question. Someone wrote here, is capsaicin eaten or put on the skin? I may have answered that when I said creams or things like this, but it is, an element or a part of peppers, bell peppers, capsicums, and things like that. So I guess in a sense you are eating it, but no, it can be extracted from these fruits or vegetables and placed in a type of cream, and topical, you put it on your skin, for example. I might have scrolled past a few questions here. I'm getting just a lot of thank you, so I must have scrolled back to the bottom. If you have one more question for this evening, you can put it in the chat box now if you like. If you're still on here, Susan, yes, the webinar is recorded, and I will be able to upload it. It should be available by the end of the week on it's a good question where it would be. I know it would be on Arthritis New South Wales website. In the webinar section, you'll be able to find it there. Do I have any advice on hemp seed oil sold for treatment on arthritis pain? I just want to say, no, I don't know explicitly or specifically. I don't want to throw you under the bus here, Bree, but if you do, you can certainly jump and ask and answer that. All I really know is what I've provided already. And I never really want to answer it unless I really know the answer and I'm confident with that. So no, I'll say no, sorry, Teresa, at the moment, but I'm more than happy to find out for you.
Yeah, I'm exactly the same as you, Kat. What you said is what I know too, but we can definitely find out and get back.
Yeah, absolutely. All right. Well, I do apologize if I've missed you, missed any questions that you may have had. There was a few in there, so you're welcome to email myself, and of course Bree on the Queensland end, because you might be able to find her contact easier than mine, and that's fine. But I think we'll leave it there, everybody. Thank you, everybody, for coming. We really appreciate seeing you all here tonight. I hope you enjoyed the session. Next month, we're looking at cognitive behavioral therapy. I'll be sort of doing a bit of a workshop on that as best I can to help you manage pain in the context of arthritis. Okay.
Thank you so much, Kat. That was fantastic. And thanks so much, everyone, for joining. What a great, great webinar.
Fantastic. And thanks, Bree. Thanks, Bree, for popping in. Thanks for coming. And we'll see more of her and Queensland in the coming months, and particularly into next year. So have a good night, everybody. And we will see you soon.
Bye. Thank you. Bye.